Let's talk about one of the most stressful pieces of mail a radiology department can receive. That end of service or end of support letter. You open it up and suddenly your perfectly functional CT, MRI, or Cath lab system is being described as a liability. Parts may not be available, service may be limited, and conveniently, there's a brand new system ready to replace it. Here's the thing, that letter rarely comes out of nowhere. If you're 12 to 24 months away from end of support, you actually have a lot more control than you might think, if you use your time wisely. So today I'm breaking down 7 things you should be doing well before that EOS letter arrives, so you're making decisions on your timeline, not someone else's. Number 1, confirm the real end of support date, not the rumor. First things first, don't rely on hallway chatter, assumptions, or we think it's around next year. You want the real, official EOS date in writing. OEMs often have end of software support, end of parts availability, end of full service contracts, and those dates are not always the same. This matters a lot for systems like MRI or CT, where software versions and gradients or detector components may have very different life cycles. Knowing the exact timeline lets you plan instead of panic. Number 2, take a hard look at how the system is actually performing. Before anyone tells you, it's time to upgrade. Ask a simpler question. Is the system still doing what we need it to do? Look at your uptime over the last 12 months. Repeat scans or image quality complaints? Has downtime impacted your patient flow? Do technologists still have confidence with the system? For example, a Cath lab with stable uptime and happy physicians may be worth preserving. An older C-arm that still images well but lacks newer workflow features might be a candidate for selective upgrades instead of a full replacement. This step grounds the conversation in reality, not fear. Number 3, inventory what parts and service actually matter. Not every component carries the same risk. Tubes, detectors, RF coils, these age differently depending on modality and usage. CT tubes are consumables. You want to know replacement availability. MRI coils, however, may be plentiful even after EOS. Mammo systems often hinge on detector and software support more than mechanics. Understanding which parts are critical and which ones are commonly available as refurbished changes the math dramatically. Number 4, explore software and hardware upgrade paths early. Here's where a lot of departments wait too long. Some OEMs stop selling upgrades before end of support. Others allow software version jumps, console refreshes, limited hardware upgrades that extend usability. This is especially relevant for MRI systems nearing software cutoff, DEXA or X-ray systems where workflow software can dramatically improve usability. If upgrades are an option, you want to know now, not 6 months before support ends. Number 5, get an independent second opinion on service options. This is a big one. OEM letters are written from their business perspective, not yours. Independent service providers often maintain access to refurbished parts. They'll support systems years beyond OEM's EOS. They can offer flexible service models like preventative maintenance, T&M, or yes, full service. This doesn't mean you shouldn't upgrade. It just means you deserve to understand all viable options before committing millions in capital. Especially for large assets like MRI or CT, that second opinion can be eye-opening. Number 6, start budget conversations earlier than you think. Even if you do plan to upgrade, waiting until EOS hits is the most expensive way to do it. At the 12 to 24 month mark, you can align your department's capital planning with your facility's fiscal cycles. Explore refurbished or like-new options. Compare replacement versus life extension costs. Avoid rush fees, expedited installs, and poor negotiating leverage. Departments that plan early almost always end up with more choice and less pressure. Number 7, document everything before emotions get involved. When EOS letters arrive, emotions can run high. Suddenly, you're experiencing concerns you didn't have the day before. Now, you're worried something might break tomorrow. If you've already documented your machine's performance history, service costs, options for upgrading and replacement scenarios, then you're making these decisions from a place of data and not stress. That's how smart imaging departments stay in control of these moments. End of support doesn't mean end of usefulness. It means you're at a decision point, and the earlier you engage with it, the better the outcome. If your imaging system is 12 to 24 months away from EOS, now is the time to gather information, ask better questions, and keep your options open. Because the goal isn't just to avoid downtime, it's to make the right decision for your patients, your staff, and your budget. If this video helped, give it a like, and stick around. We've got more coming on what EOS letters really mean and how to respond when one finally lands on your desk. Thanks for watching.